Have you ever walked into a room and completely forgotten why you went there? Or maybe you've started noticing names, details, or words slipping away more often than before. Many people over 60 assume memory loss and mental fog are just part of getting older. But what if the real culprit is sitting quietly in your medicine cabinet? Pills you take every day that are slowly dulling your brain. Today, we'll uncover 4 common medications shown to harm memory, focus, and overall brain function, especially in older adults. This isn't about scaring you, but about awareness, knowing what questions to ask your doctor and what safer alternatives may exist. So, let's explore the truth behind these 4 hidden medications that could be quietly affecting your brain health. Let's start with antihistamines, which almost every senior has taken at some point. These pills, like Benadryl or diphenhydramine, are taken for allergies, sinus issues, or sleep. They block histamine receptors, but also block acetylcholine, a chemical vital for learning and memory. When acetylcholine is blocked, brain cells can't communicate properly, leading to slower thinking, confusion, and increased dementia risk with long-term use. A JAMA internal medicine study found that regular use of strong anticholinergic medications, like first-generation antihistamines, significantly increased Alzheimer's risk. Some people report feeling mentally foggy or detached after just a few doses. For allergies or sleep, ask your doctor about non-drowsy, second-generation alternatives like loratadine or cetirizine. These newer drugs don't cross the blood-brain barrier as easily, making them far less likely to cause memory issues. The second medication is proton pump inhibitors, or PPIs, used for acid reflux or heartburn. You might know them as omeprazole or esomeprazole, commonly prescribed for indigestion. PPIs reduce stomach acid, but your body needs that acid to absorb key nutrients like vitamin B12 and magnesium. Low B12 is linked to brain shrinkage and memory loss, while magnesium is essential for neuron communication. Daily PPI use can deplete these nutrients, starving your brain of what it needs to stay sharp. Long-term PPI use has been associated with an increased risk of dementia, especially in seniors who take them continuously for years. If you've been on PPIs long-term, discuss gradually reducing your dose or switching to safer options like H2 blockers or natural remedies with your doctor. Small lifestyle changes, like eating smaller meals and avoiding lying down after eating, can also make a big difference. Now let's discuss sleep aids and anxiety medications, particularly benzodiazepines. Drugs like diazepam and alprazolam are prescribed for anxiety, insomnia, or muscle spasms. They calm the nervous system, offering relief, but there's a dark side. Benzodiazepines slow brain activity by enhancing GABA, leading to dependence over time. This can cause withdrawal, reduced alertness, and a higher risk of confusion or falls, especially in older adults. Studies show a strong link between long-term benzodiazepine use and cognitive decline. A Harvard review found older adults using them regularly were nearly 50% more likely to develop dementia. If you use them, don't stop abruptly. Talk to your doctor about a slow taper plan and explore alternatives like melatonin or herbal options. Mindful breathing, guided relaxation, or short evening walks can also help regulate sleep naturally. Finally, the 4th medication might surprise you: anticholinergic bladder medications. These are prescribed for overactive bladder or incontinence, with names like oxybutynin or tolterodine. They block acetylcholine to relax bladder muscles, but this chemical is also essential for brain function. Blocking acetylcholine throughout the body reduces brain cell communication, leading to foggy, forgetful feelings, especially pronounced in seniors. Research from the University of East Anglia found that people taking these bladder control drugs had a 30 to 50% higher risk of cognitive decline. For older adults already managing mild memory issues, that's a significant risk. Ask your doctor about newer non-anticholinergic options like mirabegron, which controls the bladder without impacting brain chemistry. Lifestyle adjustments like bladder training, pelvic floor exercises, and reducing caffeine can also make a huge difference naturally. Medications aren't inherently bad. They save lives and improve quality of life. However, as we age, our bodies process drugs differently, and our brains become more sensitive to chemical changes. The key is to understand your prescriptions. Review them with your doctor or pharmacist annually. Ask if any have anticholinergic effects or impact memory. A dosage change, a switch to a newer drug, or a natural alternative can protect your brain. Never make changes on your own. Many medications require careful tapering, and stopping suddenly can be dangerous. Always consult your healthcare provider before making adjustments. Your brain is your most valuable asset, holding your memories, stories, and relationships. Protecting it means being proactive, informed, and unafraid to ask questions about your health. If this video was helpful, share it with a friend or loved one who might be taking these medications. You could be helping them preserve their memory and mental clarity for years to come. For more videos on senior wellness, brain health, and natural healing, subscribe and turn on notifications. Every week, we share practical, research-backed tips to help you live longer, stronger, and sharper. Thank you for watching. Remember, taking control of your health starts with awareness. Stay curious, active, and kind to your body and mind.